Welcome back to Mom Saving Grace. Today I want to talk to you about how to be your own advocate when you're staying in these recovery homes post-plastic surgery. As many of you already know, I am a RN, so it gave me a good background to be my own advocate when I was going into surgery. And I also know what good incisions look like when surgeons are skilled at what they do. I've been in enough cases to see the good and the bad. So I wanted to share my knowledge with you on how to be your own advocate, especially if you're staying overseas or in a recovery home. For myself, I stayed in Dollhouse recovery. This is probably one of my second most asked about questions outside of plastic surgery was how was my stay at the recovery home. I tried to stay for as long as I could so that if at all possible, I could have a drain removed by Dr. Puebla before I left Mexico. That turned out not to be the case, which didn't freak me out because I've removed them before and I knew how to remove them. I would suggest to you that you don't base your decision on how long you stay somewhere, whether or not you have a drain or not, because some people can keep those drains over 20 days. It just depends on your body. I suggest that before you go down that you can find someone who is either a nurse. Sometimes some people will have physicians in their area that you pay them $150. I know there is one in here in Dallas that you can pay them some money for a consult fee. You come in and they'll check your wounds and remove the drains. Those are hard to find. You are probably more likely to find nurses that are trained in post-op care who do private work, LMTs who are very, very experienced. You don't want anybody to do it, but who have pulled lots of drains before and come with recommendations. You may be able to find someone like that. But I suggest that you find even your primary care. My primary care practitioner was very, very supportive of me, ran all of my pre-op labs and everything, and fully supported me knowing that I did my research before I went to have surgery. So find someone that can be your advocate, find someone that can take care of you afterwards, and don't put all your eggs in one basket because you don't want to force a physician to pull their drains because of a time constraint when you're not ready to be drained, because in the long run, it creates a lot more problems. For example, seromas. People tend to get seromas if those drains are removed too soon. And that doesn't mean that they can always be prevented no matter when the drain is pulled, but it is very common if you pull the drains too soon, you get a pooling of serosanguineous, which is like clear fluids mixed with blood or bloody materials that get trapped in a pocket. If that body is not able to get rid of those fluids either through lymphatic massage or through its own lymph system, it will pool, and sometimes it can even encapsulate, and they actually have to go and do a second surgery to remove the capsule because it'll continue to just keep filling up no matter how many times they go in to drain it, either manually by a syringe or whatever. So sometimes they have to go in, surgically remove that capsule and add another set of drains and drain you until it's kind of like the skin and the fascia and the muscle and all that stuff need to adhere to get rid of that pocket, or your lymphatic system needs to be able to regenerate enough, or you just need to be in a state of healing enough where those capillaries and things that were all cut seal off and you stop leaking that interstitial fluid into that space, okay? So just have really good support, and I suggest don't have your mindset, I have to have my drains when I leave. They're very easy to take care of. I have another video, I think, about changing your faja with them. Maybe I could do another one about removing drains, but there's lots of them out there. I probably don't even need to do that. There's several on YouTube already where you can see how people pull their drains. Just make sure that you have the support system set aside for you when you come back to the United States, or even if you're in the being your own advocate. If you feel that some of the things to watch for would be blood loss. If you've had a tremendous amount of blood loss that does not stop after the first 24 hours, that needs to be reported. Signs of that also would be a very fast heart rate if you feel like your heart is beating out of your chest. If your blood pressure is very, very low. If your color is not good, a gray color is always almost an emergency to me, because I know that's something going on with the body where someone is not circulating the blood correctly. So I always watch people's color. You can almost always see it in their color first. If you're having some dizziness, now please understand, some elevation of a heart rate for the first few days can be normal, because with plastic surgery, this is why they check your hematocrit, your H&H, to make sure that your blood levels are steady enough that you can withstand a blood loss without it being a crisis for you. So some of us, most of us, are mildly anemic when we come out. So you will experience some dizziness from standing or sitting. That's why they recommend when you take a shower that you sit on a chair or a plastic chair, because the blood dilates to the feet when you're in that hot shower. So make sure that the water is not extremely hot, but warm, just warm enough for you to shower. Have someone with you on the first couple of days when you're taking a shower. So you may experience some changes in volume when you stand up. You can become hypovolemic. You can stand up really fast and feel the room spinning. Some of that is normal, but if it is persistent and you continue to push fluids and you're taking your iron, or if you're feeling really, really bad, then you need to go somewhere and have your blood count checked. If you are in a recovery facility, a lot of those do not provide nursing care. They have some women that are the equivalent, if you're overseas, of RNs that can provide care, but because of insurance reasons and etc., they may not provide to you nursing care, and they will tell you that in your contract with them, and they will explain that to you. So you need to make sure you're reading the fine print. And what that means for you is there is no monitoring of blood pressure regularly. They wouldn't start an IV on you if you got dizzy. There are some places, like there is a nurse in Tijuana that would take your vital signs, communicate with your doctor, and would start an IV to just provide fluids if it's just a fluid issue. So you can look into those things, but most of these places do not provide that. It is what would be the equivalent of stateside of having a CNA take care of you. They are very loving. Will take care of all of your needs for you. Wash your faja. I do recommend that you ask them to wash your faja separate from others, but they will wash your faja. They'll help you in the shower. They take care of everything for you. They feed you. Where I stayed at Dollhouse, the food was wonderful. They had 2 to 3 women on shift each, for a 12-hour shift. They cooked, they cleaned, they would wash your clothes, they changed your sheets daily. It is immaculate in there. They take great care of you, but it says in your contract it is not nursing care. Now, some of them can give you a lot of wisdom because either they are nurses, even though they're not supposed to provide nursing care, or, they've just taken care of so many patients. So they're very good. And you say, what do you think about this? Do you think that's okay? And they'll say, yes, it's totally fine. No, it's fine. But even I had some issues where I thought it looked a little strange and they said it was fine. And then I ended up going back to the doctor and I had to either have extra antibiotic. So even though they may say, yes, that it may be based on what another physician would say or their experience, but I'm telling you, you have to follow your own mind. I was just an advocate. I knew when things didn't look right. We had a woman that needed to have blood and she was very symptomatic, and just because I had the experience, I told her to have them check her blood pressure. It's not something they'll offer, but at that particular recovery home, they have a blood pressure machine there. They can take it for you, but you need to call your own physician. They'll call doctors for you, but I'm saying, be your own advocate and call them and let them know, hey, my blood pressure is low, but my pulse is up. So that is normally what you'll see if there's some sort of blood loss or you need blood after surgery. Your blood pressure is usually very low because there's not enough volume because you've lost blood, and your pulse will be high, like over the hundreds. So, and you usually will start to feel lightheaded with that, and your color won't be good. You'll feel dizzy, sleepy. So if you're finding that, or you're having changes where you're really dizzy and sleepy from going lying to standing, as I said, some of that is normal. But if it's persistent and you're feeling nausea, especially, that's accompanying that, you need to report it to your doctor and have them check your blood work just to make sure that you don't need any replacement, either with fluid or with blood, okay? So as I was saying, someone had an issue and I said that they should call the doctor. They ended up getting blood work and they needed to have some blood replacement. I'm not saying that facility wouldn't have called or whatever. But I think that you need to be proactive because they're limited by their contract of what they can provide. That you need to make sure that if you're feeling off, even if someone says, no, you look fine, or, you know, everybody has experts in the group, if it's in your gut, I want you to call your physician to make sure. Most of these doctors, mine is excellent, and that was one of the reasons why I chose him, is because there has always been a very good report of his aftercare. Even things go wrong for people, even in the best case scenario, and he is always, you can get in touch with his surgical coordinator at 2 o'clock in the morning. And so that is one of the criteria that you need to be researching. How was their aftercare? If something happened, which things happen, how quickly were you able to get to that doctor, and how willing were they able to take care of you? The other thing I want to tell you about incisions and surgeries, plastic surgeons, they're not wound care specialists. Now, they do a lot of wound care monitoring and a lot of wound care for people, because just by nature, people split stitches. The nature of the surgery, wounds happen. Infections happen under the best case scenario, but they're still not wound care specialists. So if you find that you have a wound that is persistent and that doctor, whatever they have prescribed to you has not worked, you need to be contacting a wound care specialist. They have wound care nurses. Contact your insurance. You may not have to go into whatever. You can say, I just had surgery and whatever, and I need to be referred. But you need to go see a wound care. If you cannot, there is a group called Women Who Care. It's a private group. It is hard to find, but in most surgery groups, go tuck yourself. There's a lot of them that are on Facebook. You can ask in there, can someone please add me to the Women Who Care group? They were instrumental in me healing. I had a small issue with my belly button that was not resolving with the care that I followed by my instructions from my plastic surgeon. I didn't realize there was a stitch that was splitting, and I was not able to go see him. If I would have been able to fly to see him, he would have saw it right away, clipped it, and it wouldn't have been an issue. But I had the support of Women Who Care. Being that I was an RN, I wasn't afraid to deal with the wound, but I knew that if I let it kind of fester and go on, it would have continued to get worse and been a real issue, and it wasn't. I'll show you pictures right now of just, it was a stitch that had kind of eroded, and my body didn't like it. I am notorious for splitting stitches no matter what surgery I've had, so I knew that could have been a possibility, and I did. Where there's tension around that belly button, they kind of do a purse string stitch, and it can be tight, and so a lot of people have issues around their belly button. They recommended Manuka honey, and I'll tell you, for anybody, Manuka honey is fantastic. The research on it is pretty mind-blowing. If you see something on your incision or whatever that does not look right, I 100% recommend it. I will link the honey that I got. You want a very high, either UMF, which is New Zealand's version of measuring the quantity of the active ingredient that is antibacterial in it. I forget how they measure it in the United States, but let me drop this slide right here and you can see the difference in the Manuka honeys. But in those wound care groups, they will have slides to tell you what kind to get. But I recommend, you can't just get Manuka honey from anywhere. You got to get, it's very expensive. It can be 50 to 100 bucks, but it's worth it, and it heals that stuff right up. The other thing about spitting stitches, if you see them and you've clipped them as low as you can, a lot of times issues won't resolve until those are removed. So make sure, that's another reason that you have good aftercare, or you have a wound care nurse or someone who specializes in post-op plastics that will do house calls for you. There's a lot of those in the area that can help you with those issues. So I am available to help people. You can contact me on I'll leave the link down below. As a consultant, just to give you advice if you need to talk through things. You know, I'm also an aromatherapist, so if there are oils that you want to take with you for relaxation or sleep, because you'll have issues with that, I recommend you taking all of those things with you, and I talked about that in another video. But I sell packs of oils that you can take with you, rollers that you can use that will help you with anxiety and whatever, and they're all very safe to use before and after surgery. So that's another way that I can be of assistance to you. So yeah, so if you see wounds that aren't right, excessive bleeding that doesn't slow in the next couple days. Make sure you line up your massage therapist. You don't want anybody that uses cavitation on you too early because it pulls the skin away and the skin needs to adhere. Ask your recovery home who they use for massage therapy. At Dollhouse, they offer a woman, her name is Marie Paz. She's excellent, and she knows what she's doing. She does a very good job. You're in very good hands with her, so pay for her services. It's well worth it. And I did it every day that I was there, almost every day, and I was there for 10 days. So the good thing about being able to stay after recovery, I was very paranoid because I have very small children, and so it was hard for me because I wanted to be home. So I was really heartbroken. They were very sympathetic to that. But it allows you, if you don't have experience or you don't have support here, to be able to see your doctor for all of your post-op visits, which usually is around the 10-day mark, 10 to 15 days. If I had to do it again, I probably wouldn't stay as long just because I was able to do so much self-care for myself. But if you don't have that support, the other thing is if you have a lot of small children, you really need the rest, and this will force you to rest in a way that you would not have being at home. I promise that I would have been working if I would have been home. So if there's any other questions about the recovery home, like I said, Dollhouse was fantastic. The one thing to remember, and I don't know if anything has changed with them, is they offer private rooms. They really only have one private room, and it does not have its own bathroom. It has a shared bathroom. But at the same time, you can kind of get over it because you really do bond with your surgery sisters that are there, and you have nothing else to do, so you're kind of okay with sharing a space with them. They are very clean, very, very sweet women. They took very good care of me. Just remember that they are not really to provide nursing care, even though they do your dressing changes. They can tell you if something looked funny, but you really need to, triage yourself if something in crisis happens. So make sure that you're your own advocate and call your physician, because they're the ones that's really responsible for you, not your caregiver that's there. All right, you all, and be your advocate for your sisters that are there also. So if you see something funny with them, encourage them to reach out to their plastic surgeons. If something's wrong, then you need to get transportation, then you call an Uber, you call whatever, get somebody to take you to your physician to be seen, okay? All right, you guys have a blessed day. I hope that was good information for you. Thanks for joining Mom Saving Grace. Now I'll show you some pictures of the Dollhouse facility. I will be covering any faces of the women who are there so I can preserve their identity. But I will show you a few pictures of my room outside the space. It was very safe. It had a guard that was there all the time, so I really enjoyed it. You guys have a blessed day. Thanks for joining Mom Saving Grace.
I just wanna call, see if we're okay, babe. All I wanna ask you is, I don't wanna push you farther away.